is the Emergency Medical Minute.
Okay, so pre-hospital airway, we see lots of studies about this, and most are kind of relatively small studies, somewhat unclear. There's been a lot in the last few years looking at out-of-hospital cardiac arrest, looking at things like airway management, looking at endotracheal intubation versus supraglottic airway versus just bag mask ventilation, with a lot of kind of messy, unclear conclusions. So in the last year, there actually has been two big studies published in JAMA, one from the UK and one from America, that look at 12,000 patients with pre-hospital, out-of-hospital cardiac arrest, and their prospective randomized trials for airway intervention. So 12,000, by far the largest numbers yet, should get totally definitive answers. Should be able to set these studies up to be able to give us the answers we want. So what do we see? In the UK study, it was called Airways 2. They enrolled 9,000 patients, again, out-of-hospital cardiac arrest, randomized to either attempt at endotracheal intubation versus a supraglottic airway. And their primary outcome was a good neurologic outcome at 30 days, a modified Rankin score of less than 3, which is kind of an objective way to look at that. And what they found is there really was essentially no change. There was 6.9% in the intubation arm had a fair neurologic outcome, whereas it was 6.6% in the intubation, in the supraglottic arm. In the American study, which was called PART, they enrolled 3,000 patients, and their primary outcome was to look at 72-hour survival, so very different, just being alive at 72 hours. And at 72 hours, 15% of the intubated patients were still alive. 18% of the supraglottic airway patients were alive. They had a secondary outcome of looking at neurologic outcomes, so a modified Rankin scale of less than 3, the same thing at discharge. And what they saw, again, was like 5% for the intubation group and 8% for the supraglottic group. So they're very messy trials, as you can imagine. A lot of the patients didn't get any advanced airway at all. In fact, in the American trial, the intubation success rate was like 51%, whereas the supraglottic airway success rate was 90%, so that's a big deal. But I think that what it does show is, again, that there's really, even though it's hard to parse through all the information, there's really not a big benefit that can be shown for intubation or over airways for cardiac arrest. And I think there's been plenty of studies that show that there's not a clear benefit to intubation or other airway over just bag mask ventilation as well, much smaller studies. But so not that it affects us a lot, but any kind of those dirty looks we may give the paramedics when they come in without an airway, it probably makes zero difference whatsoever. So they got other important things to do. Yeah.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.